my project on sickle cell anemia. And so, a little bit of background information on sickle cell anemia. It is a genetic disease that affects how the red blood cells develop in the body. It is an inherited disorder that needs to be inherited from both parents. So, in this project, I'll talk about how the genetic disease and its origins, how it developed over time, over the past few decades. Also, I'll talk about how it affects the human body and the treatments that someone will have to take, to help them with this disease. And then I'll talk about the statistics on this disease and also my personal perspective on this disease. So, yeah. So for its origins, researchers have shown that the mutation causing sickle cell disease first arose in Africa over thousands of years ago to help protect against malaria, which was a big disease back in that day, and it was the major disease that killed a lot of people. And so as time progressed, the genetic disease became more commonly in today's society, and this disease was first discovered in 1910 by Western medicine. This genetic disease, decades later, was known as the first molecular disease, and basically this means this was the first disease that was examined at a molecular level. And as time progressed, the genetic disease has mutated into the disease that kills its host. And the life expectancy for someone with this disease is no more than 42 years of age. The only thing that this disease really helps with is it helps fight off malaria, and you're less likely to die from malaria. But as time went on, the disease mutated and started killing its host. And so, sickle cell anemia affects the body in many different ways. The disease is inherited from two parents that are carriers of both sickle cell diseases. So you have to get one from one set of each parent, and this condition is inherited in an autosomal recessive pattern, which means both copies of the genes in each cell have mutations. Sickle cell anemia can lead to many complications, and some of these complications can turn fatal. Some of these complications are strokes, acute chest syndrome, pulmonary hypertension, organ damage, splenic sequestration, blindness, leg ulcers, gallstones, priapism, deep vein thrombosis, pregnancy complications, and many more. And so the least severe disease would be splenic sequestration, blindness, leg ulcers, and gallstones and priapism. And so splenic sequestration is where the sickle cells are pulling in the spleen, and this means that there's a drop in the hemoglobin in the body and can be fatal if it isn't treated in a timely manner. This causes death for a lot of children under the age of 5, and a lot of children around the age of 8 tend to have no spleen at all. The next complication is blindness, and this is basically where the sickle cell blocks the blood vessels in the eye, and over time, the eyes will slowly become blind. Leg ulcers are just open sores that are very painful on your legs. Gallstones are stones that form in your gallbladder, and these are caused by the breaking down of the red blood cells. And the less severe complication with sickle cell would be called priapism. And this only affects men, and this causes men to have very painful erections, and this complication could lead to men having erectile dysfunction. Okay, so now moving on to the more severe complications, which would be strokes, acute chest syndrome, pulmonary hypertension, deep vein thrombosis, and organ failure. And so for the strokes, they can occur when the sickle cells block blood flow, and symptoms of a stroke would be weakness in the limb, mainly on the left side of the body, and a sudden slur of words. Once this occurs, someone should seek medical attention immediately, especially if the host is a child. The next complication would be acute chest syndrome, and this is where the host has a lung infection because of the sickle cells and can lead to the host not being able to breathe. And then another complication would be pulmonary hypertension, and this is where the host is caused to have high blood pressure, and it can turn very fatal very fast. The next complication would be deep vein thrombosis, and this is basically where blood clotting happens and can move into the vein, which is very fatal to the host, depending on how fast it affects the host. And the last fatal complication would be organ damage, sickle cells will affect the organs to where they won't receive as much oxygen as they need to help the host with his body, and this will lead to organ failure and the host dying because the the organs will have not rich blood. Okay, so and then for the day-to-day activities, sickle cell disease has a major impact on your day-to-day activities. It causes their host to become lethargic and have intense pain on some days. The daily activities would be house cleaning, cooking, and taking care of children because it becomes a struggle for most people. In the majority of cases, a host will try to stray away from the most activities because of the pain level they endure. And children, the pain isn't as tolerable. Most kids will miss a lot of school, and this will become an issue for the child in his future because the academic performance will slip and fade into where they will be behind in school. So now we talk about treatments for sickle cell anemia. So although sickle cell anemia is a disease, there are treatments that can be given. For children, you must figure out how crucial the disease is and figure out how to help your child. A few things to help children with sickle cell is a healthy diet, a lot of fluids, mainly water, and a lot of rest each night. A parent will also have to make sure that a child is away from any cold temperatures or cold water. They have to try their best to keep your child from getting any infections because it is crucial on how the virus responds to the body. An infection could have no seriousness at all, but you shouldn't take the risk of causing an infection, potentially causing the worst for your child. For adults, they can have bone marrow transplant, and if all goes well, they could possibly be cured from this disease. If they aren't cured from the disease, they can have different medicines to help a host blood cells. There's a medicine called hydroxyurea that a host can take as long as they're over the age of 9 months. A child under 9 months isn't allowed to take this medication because there is no information about how safe or effective this medicine is for children under 9 months. Another type of treatment that a doctor might recommend is a blood transfusion. There are 3 types of transfusions that a doctor will recommend. There are acute transfusions, red blood cells transfusions, and regular or irregular blood transfusions. Acute transfusions help treat a host with severe sickle cell anemia. Red blood cell transfusions help with the number of blood cells since most of the red blood cells are sickle cells. The last transfusion, regular or ongoing, is used for lowering the chances of a host to have another stroke if they've had one in the past. Healthcare providers also recommend blood transfusions for children who have abnormal transcranial Doppler ultrasound results because transfusions can lower chances of having another stroke. There's a lot more to know about sickle cell anemia. Out of all the genetic disorders, it is the most common amongst them all. According to the Centers for Disease Control and Prevention, sickle cell disease affects about 100,000 people in the United States. It also affects the millions of people worldwide and is most common in Africa, the Mediterranean, and Arabian peninsulas. Genetic disorder doesn't only affect African Americans as most might think. It also affects the Hispanic population. Another fact about this disorder is it is the most common type of sickle cell, hemoglobin SS. It is inherited from both parents with the 1S. And some more fun facts about this disease is that in every 365 African American children that are born, one person is diagnosed with sickle cell disease, and in every 1,200 Hispanic children that are born, one of them is born with sickle cell disease. And every year, there is a prediction that 300,000 babies are born with sickle cell disease. In most cases, this happens in Africa or in New Mexico.